Good day everyone, I am Jeffrey Tamayo and I am BEd 2A. This time I'm going to report about the topic of the language disorder. So before anything else, let's pray first. Dear God and Heavenly Loving Father, thank you Lord sa mga blessings na iyong ibinigay sa panibagong umaga, sa mga pagproprovide ng aming needs at sa mga pagbibigay ng kaalaman sa araw-araw. Lord, i-guide niyo po kami sa umagang ito, naway ang aking topiko ay may deliver ko ng maayos at maintindihan din ng mga tagapakinig. Sa umagang ito Lord, binabalik ko po ang pagpupuri at pagpapasalamat sa pangalan ni Jesus. Amen. So this time, I'm going to discuss about the topic of the language disorder. So language disorder. The American Speech Language Association defines language disorders as the abnormal acquisition, compression, or expressions of a spoken or written language. The disorder may involve 1. Some or all of the phonologic, morphologic, semantic, syntactic, or pragmatic components of the linguistic system. Individuals with language disorders frequently have problem in sentence processing and retrieving information from short and long term of memory. Children with language disorder manifest delay or lags in language development. They lack age-appropriate language comprehension or receptive and expressive abilities in the basic phases of communications, namely listening, speaking, reading, writing. However, a child who has a language delay may not necessarily have a language disorder. A language delay implies that the child is slow to develop linguistic skills but may acquire them the same sequence as normal children. Generally, all features of language are delayed at about the same rate. On the other hand, a language disorder is present when there is disruptions in the usual rate in the sequence of the milestone in a language development. So the following are factors that can contribute to a language disorders in children. So first is cognitive limitation or mental retardation. Second is environmental deprivation. And third is hearing impairments. Fourth is emotional deprivation or behavioral disorders. And fifth is structural abnormalities of speech mechanisms. Lack of motivation at home to engage in communicative activities may discourage a child from developing her own skill in using vocabulary learned in the expressing ideas. As a result, problems connected with the form, content, and use of the language occur. So, form problems covers phonology, morphology, and syntax problem. They range from difficulty or decoding spoken language, abnormal use of prefixes to abnormal structures of words and use of tenses. Content problems includes semantic disorder manifested in poor vocabulary development, inappropriate use of words, and poor comprehensions of the meaning of words. Use of pragmatic problems cover the inability to comprehend or use language and context or conversation on various serious situations. Some example of language disorders are discussed below. So first is central auditory processing disorder. A problem processing sounds contribute to a hearing loss or intellectual capacity. Second is aphasia, a language disorders that results from damage to parts of the brain responsible for language. And the third is aprasia, or verbal aprasia or dysprasia, a condition where the child has trouble saying that he is or she wants to say correctly or consistently. Dysarthria or speech condition where the weakening or the muscles of mouth, face, and respiratory system affects the production of oral language. The next is speech and language disorders that results from hearing impairment. So, the most devastating effects are deafness and other forms of hearing impairments is on language development. Thus, the person who are deaf or hard of hearing manifest speech and language disorder as a result of conductive sensorineural auditory nerve, central auditory nervous system, and function hearing issues. Manually, through sign language and arbitrary gestures and movement or orally, speech, reading, and auditory training, this adaptation cannot appropriate normal speech and language development. Etiology or speech and language disorders. The causes of speech and language disorders are complex, such as functional, organic, and congenital or etiological factors and trace to brain damage, injury, accidents, disease, and trauma can result in a childhood aphasia or loss of language function. Second is incidence and prevalence. Language and speech disorders in a high incidence disorders. In considering incidence and prevalence figure, we have to take note of the fact that there is a strong relationship between communication disorders and learning disabilities, and primary disabilities should be identified. Learning and behavior characteristics. Children with speech and language disorders have problems in receptive and expressive. They have difficulties in understanding what is meant by spoken communications, as shown as in the inability to follow direction, improper use of words, difficulty in expressing ideas in oral signs or written forms, inappropriate grammatical patterns, and minimal vocabulary. Speech and language disorders negatively affect cognitive functioning, social interaction, and behavior. Children with disorders are perceived to be inattentive. They develop feeling of frustration that causes them to withdraw from social group. Assessment procedure. The following steps are prescribed by the Special Education Division Bureau of Elementary Education of the Department of Education. First is pre-referral intervention. Teachers in regular classes, parents, classmates, and other people who communicate with a child regularly report the student who is suspected to have speech and language disorders to the school's principals. Second is multi-factored evaluation. Ideally, formal evaluation must be done by a speech pathologist. Educational programs. In line with the practice of exclusive education, The child with the speech and language disorders keep in the regular classroom as much as possible. Classroom management provides for a preferential seating arrangement, minimum distractions, and opportunities for interaction. The child works with the special education teachers or speech pathologists for speech habilitations. The American Speech Language Association offers some suggestions for the regular teachers in exclusive classes and for the special education teaching as well. Introduce changes in the home and school settings, especially if the child has a central auditory processing problem. Reduce external visual and auditory distractions.